One of the most important aspects in a city's life and prosperity is the health of its citizens. Obviously, we're living in a time of great debate and wrestling with this issue in places all over the world, not just here in the United States, but across North America and around the world. We can see in New York City, Mayor Bloomberg has decided that one way to tackle the health issues of his city is by shrinking the size of soda pop drinks. In New Jersey, across the river, the Healthcare Quality Institute is encouraging mayors across the country to use their bully pulpits to help deal with the obesity epidemic through the National Mayor's Wellness Campaign. Cities around the world have begun to think about how they're laid out and designed as an issue of public health. In Vancouver, for example, there's a push on to create more bicycle lanes in order to get their residents exercising on the way to work. In Mumbai, India, they're trying to plan and build adequate sewer systems and water systems in order to make their people healthy. Across the United States, there are significant projects and programs underway to restore the walkability of our cities so that people can get around on foot and not just in their cars. The salient point of all this is that in our rapidly urbanizing world, our cities have a major role in determining human health. Now, to give us some insights and overview of this important topic, please welcome a leading national thinker and practitioner on the subject of healthcare and public health, Dick Flanigan, from the Cerner Corporation here in Kansas City. Dick?
All right, guys, good morning. I tend to move around a little bit, so I hope that's okay for you guys. And we'll take some questions as they go. If you find something really interesting that you need to kind of stop me on, feel free to take a moment and raise your hand, and we'll try to address it as we go. Now, a couple things. First off, it is really cool to be up here. I know you may have heard this from some of the speakers, but I know I'm never going to be up here as a musical or theater performer, so to be able to speak to you is just incredible, to be enveloped by this wonderful facility. It is a great day to be in Kansas City, and we are delighted that so many leading thinkers and to the CityAge folks for putting this program on. It's great to hear the story. Rob gave us a little shout out as the Cerner Corporation. Some of you may not know Cerner very well. In fact, if you saw Cerner on the agenda and you did know us, you'd probably say, oh, they're going to talk about using Google Fiber. They're going to talk about information technology in the greater Kansas City community. And I'm not. I'm hoping somebody mentioned that we will take great advantage of that super infrastructure. We're delighted with those investments and the public-private partnership. But in reality, what I want to talk about is something that actually isn't a whole bunch on this agenda, and that's about health. And I think health, in fact, really should be viewed as the new economic development weapon. So if we think about why people choose cities, why people choose metropolitan areas to grow their business, in fact, what we're seeing is lots of the things that you're talking about here today and yesterday. But in fact, I would argue that at the core of picking a great place to live, to raise your family, to grow your business, is fundamentally about a place that promotes and encourages health. Healthy is not really in and of itself an outcome. It is really about the ecosystem that supports a healthy community. Now, I'm going to show you a couple of measures that have come out. There's lots of people that like to measure health in a community. And I'll give you two specific ways that can be looked at. But those are numbers. Those are kind of outputs of what people would say is healthy. And yet, interestingly enough, regardless of the measures, it turns out some of the same cities seem to be at the top of the list. And you probably know them. Portland, Minneapolis, Salt Lake, Denver. Lots of different ways we can measure it, and yet there's a cluster of cities that tend to stay at the top. There also, conversely, is a cluster of cities that often find themselves at the bottom of these lists. And so explaining why that's occurring and how through public and private partnerships we might raise all players to a new space of health is really the focus for my comments this morning. Now, interestingly enough, you're all discussing infrastructure and investments that have to be made. I would propose to you that one of the challenges is we are explicitly and implicitly investing in healthcare at the expense of other investments that you want to make as a community. And I'll show you a couple of examples of that. So, America's Fittest Cities. This one looks at clubs and walking and all kinds of fun stuff. And you can see some of the measures there, the Minneapolis and the Portlands and other great cities. Now, if you look at something that's a little different in terms of BMI, a very objective measure of health. Now, granted, not all high BMI individuals are necessarily unhealthy. But if you were tending to look at kind of the measure, again, you can see certain cities represented here. It's not my intent to call out any one particular city versus another, but to point out that we're rating this. Companies care about this. Individuals care about this. Families care about this. And for those of you that thought it's just the good weather, the folks in Minneapolis, which I'm sure have very good weather, if you like it a little colder, but I don't know how you can beat what we got here in Kansas City the last couple of days. It's like this always in December. Really, just come back, promise. It's really great. So, how are we going to pay for all this healthcare infrastructure? How are we going to pay for all these roads and schools and all the other things that we're talking about that make great American cities? Well, sadly, you're actually not going to have money to do that. You think you will, but you're running out of money. And you're running out of money because you're overpaying for healthcare. And the cities can help lead the transformation towards a new American health system, which leads to healthy cities, great cities, and we'll talk about that how. Okay, so this is actually an interesting slide build that's not building. So I'm going to talk through what essentially is occurring in healthcare. First and foremost, we all understand what's happening with the federal budget deficit, and increasingly the amount of money that is being spent to fund both entitlements, and I'm not saying entitlements are good or bad, they are. Medicare, Medicaid, Social Security, and other programs. Increasingly, those entitlements are taking a larger and larger portion of the federal budget. And behind this is a very nice slide that shows as you as you spend more and more on entitlements, you're actually spending less and less broadly. As a percentage of the federal budget, you're spending less on investments. And why is that happening? Because increasingly, states and cities, both in terms of their employed relationship and the portion that states are paying for Medicaid, is having a negative effect on the ability to invest in K through 12. And so the punchline of this slide is very simple. As we spend more and more money on healthcare, it is crowding out other investment and spending opportunities in our states, in our country at large, and all the way down to our schools. There is a direct relationship between the increased spending on Medicaid in our states and decreased spending in K through 12. And what's a nice way to measure K through 12 spending is to look at class size. And you see this pattern emerging throughout the United States. So the question remains, you can have all the health care you want, you can get it when you want it, you can ask for all the tests, but are you willing to give up investments in education? Are you willing to give up all these other investments in infrastructure? Because that's what you're voting today. That's essentially what we have said as a U.S. economy. You know the numbers. Healthcare represents 17.3% of our gross domestic product. Of all the goods and services we produce, close to $1 out of $5, approaching $1 out of $5 is healthcare. I benefit from that. My company benefits from that. We have many great healthcare organizations in Kansas City that benefit. But we're investing at the expense of other things that we all value as a community. There is enough money in the system, folks. We're not talking about taking some massive reduction. We don't need to get like the UK, which spends 8% of its GDP on healthcare, or 11 or 12% for France and Switzerland and Germany, all of which have good healthcare systems. We are willing to pay more, but if we stay on the current path, we will not be able to invest in all the other things that we see as valuable within our cities and towns. So where do you want to spend your money? Do you want to spend it on programs for seniors, parks and recreation, preventative care, our children? It's kind of up to you. That's a choice we have to make as leaders in this community. So where do we go from here? Now, we could make different choices, and most people actually think healthcare reform solved the problem. We walk through one door, we're in deeper. And the reason we are is fundamentally healthcare reform, and I'm not wanting to debate the political side of this for anybody in this room. There are many, many positive elements of the Affordable Care Act. I'm reminded that the president says it's now okay to call it Obamacare, okay? So I've been chastised in some talks in, the last couple of years because I was, affectionately referring to it, but now, of course, the president said it's okay to call it. He said he kind of liked it, so we can call the Affordable Care Act that or the Obamacare. There are an awful lot of really good things for cities, good things for citizens. But again, we didn't fundamentally go refine and change some of the cost drivers and the elements of healthcare. A lot of good insurance reform, other markets reforms, but healthcare reform is not fundamentally solving the problem that I just referenced, which is lots of money being spent, and frankly, we're not getting great outcomes. Do you realize that? We're not a healthy country relative to other spending. We don't get great value for this investment. So, what might we do differently? Much of what we measure in healthcare today is on two things. If we drive around and look at the billboards for the great healthcare systems here in Kansas City, you'll see them reference a couple of things: quality and safety. Malcolm Baldrige Award winner in town, Leapfrog, lots of these measures. Some of you may be familiar with those. Safety. Seriously? It's not safe to get healthcare? Do you really think about that when you go pick healthcare? Gosh, I hope they don't hurt me today. I hope they don't cut off the wrong body part. Gosh, I hope I don't get a different infection than what I came in with. Oh, you didn't realize that that actually happens? There is a safety issue in healthcare. There are quality issues. They've gotten dramatically better. But as purchasers and as citizens, do you really want to have to evaluate your healthcare provider on that? Shouldn't that be table stakes? Shouldn't that be the basics? What we really want is an outcome. What we really want for our families is to be healthier. What we really want as purchasers, the governments, the individuals, the businesses, what they want is they want value for their healthcare dollar. They get we're going to spend more. May not like it, but we want value. We want to know that our employees are well taken care of. So this not so subtle shift that has to take place begins to change the conversation in healthcare from we're great quality and we're safe, thank you, to something different, which is we provide better outcomes around the patient and their expectations, and for you who pay for this, which is individuals in partnership with the employer or the Medicaid or Medicare system, we get better value. And we can define value lots of ways, and we can find lots of different outcomes. But that's fundamentally the shift that has to change when it comes to healthcare. So, what are some of the ways we might do that? There's some initiatives that are kind of cool to talk about. There's two principles on health broadly and health promotion. And it's food and it's movement. These are pretty simple principles around driving towards health within a community. So, lots of studies. Some of you have seen some of the really cool graphs that track fast food, diabetes, obesity, and not that we don't want choices in our society, but sometimes we haven't offered within our cities the healthiest food choices. Sometimes there is no choice to get certain types of healthy food. We recognize that. Well, one of the really innovative programs here in town is a client of Cerner, a Truman Medical Center, a 2-hospital system, one in the urban core over at Hospital Hill and one out in a more suburban location. And it turns out that John Bluford, the CEO, and his leadership team decided this food thing was a big enough issue for their employees as well as their patients to not only open a farmer's market, which has kind of become trendy in hospitals, but that's pretty darn cool, right? To get healthy food where you work. But more importantly, recognizing that there are, as Michelle Obama talked about, these food deserts. There are places where you can't get good food in our urban core. So what do? Do you complain about it? No, you go with a public-private partnership, you get an old bus, you convert it into a moving market, and you go to the places where people need to learn about buying and using fresh food in their diet. Food, #1 thing to drive towards health. 2 is movement. You have lots of examples that have been talked about. Good streets, walkways, bike paths, good lighting, safe and secure place to call home. All essential elements of that fundamental change. Thinking about movement as a way to complement good eating leads to good health. So all of the mixed-use developments that have been talked about, all the ways where we put green space and open space and play space as a way to create movement back into our communities is critical. There's some great examples here in KC. There's some great examples around the country. So those are 2 fundamental principles on the change in terms of healthy cities. The second thing is, how do you engage people who pay for health care? So there is this big debate ongoing about, will employers stay in the health care insurance game? Because they can pay a relatively modest tax, which is generally lower than they're investing in health care today. So why wouldn't employers just exit? Let the federal government take care of it. Why would an employer be incented to stay in the health game, and in particular the health insurance game? I work in an incredibly competitive industry. I have to attract and retain engineers, designers, software architects, implementation professionals, nurses, clinicians, all kinds of different physicians to help us do this information technology in healthcare. I need to create the most competitive place to work, to live, and a benefit package that attracts people. And we have done enormous things within our community. We operate 2 health clinics. We'll open a 3rd clinic at our campus out at the Legends. We believe that healthcare is fundamental to what we do with our employees. And many other employees around this region, around the country, are doing the same thing. So employers are staying, in our experience, particularly larger employers, are staying in the game. There are a couple things that we're working with the local public-private partnerships. The Chamber of Commerce initiated a program earlier, or in 2011, called the Big Five, to outline 5 significant, you may have heard a little bit about those from some of the other speakers, or will hear. I'm working in particular, along with my colleagues from Cerner and other, on translational medicine, getting rapid developments in innovation, whether that be healthcare delivery or medical science, to get that quickly into the hands of clinicians and to impact patient care. Well, we took a little different turn with that as our mission, and we worked with many of our major stakeholders: St. Luke's, University of Kansas Medical Center, United Healthcare, Blue KC, and lots of people who compete with each other. And we're coming together to say, if we're going to make this shift from quality and safety of table stakes expectations to outcomes and value, what would we do? Well, the first thing we do is we would ask you guys, what do you expect from your healthcare system? What decisions do you want to make on behalf? When you go in for a heart procedure, when you go in for low back pain or chronic back pain, you have a choice to make. And it turns out there's very good research on what are called preference-sensitive conditions, conditions where you have a choice. It turns out when I give you all the information, guess what you choose? The least invasive, less costly alternative. Do you know that the Dartmouth Institute, which is kind of one of the preeminent think tanks here, their estimates, and these are not like harebrained, oh, we just came up with this. They've studied the data. Over 30% of the hospital admissions in this country are unnecessary. 30%. Hospital spending is 1/3 of that big number, guys. We're talking billions and billions of dollars that could pay for infrastructure, that can pay for schools, can pay for transportation. Those are the choices. So in this public-private partnership we have here in KC, we're starting with this outcomes working group, and we're working on things like angina and PTCA and back pain and many more things to come down the line. So just some interesting saying that we can talk about this, we can give presentations on this, or we can actually go out and try to do something together. And that's some of the fun of working here in KC. Now, an example, I was doing some kind of quick research about the impact of health, and I found this firm, and actually one of their associates, Katie Seaball's here this morning. I met with Katie, and I asked her, tell me about the mixed-use work that MBS is doing. And she showed me this picture, and I was so heartened by it, because guess what's on there? Healthcare, right? It's part of the thinking. I'm not sure it's been part of all the thinking that we have seen in much of the work around great cities. And it's a fundamental part of what we should look for in great cities. So let me close with kind of what's next. First off, please, you guys are really important people. You're doing great things. Give healthcare a seat at the table. More importantly, give health a seat at the table. That's what we need to complement all the other great work and the great thinking you're doing. These partnerships already exist. We're not having to break new ground here. Employers are working with providers. Providers are working with payers. Payers are working with government and public health departments. Those partnerships exist. By the way, the ideas are out there. Yes, we welcome new ideas. There's all kinds of new innovation. But there's a lot of stuff that's already been proven. We just need to scale. And we need the political will, the business will, and all those other aspects of gaining confidence that we can actually go do these things. There's enough money to pay for all the things we want to do to continue to give you the best healthcare system and to make America the healthiest nation on the earth, which today we are not. So lots of room for opportunity. So my simple principle is, folks, we cannot afford to not do this right. I know it's a double negative, so I'll close with a positive. We have to get this right. The things you all want to do are going to be funded by appropriately spending our healthcare dollar. Without it, we will eat up the budget, and this will be just an interesting conference and not really lead to fundamental change. So with that, thank you for the opportunity. Thanks to the CityAge folks for the opportunity to be part of this, and look forward to questions or comments throughout the day. Thank you.